It's really easy reading, and it really will add to the many terms and concepts that we'll be discussing, and it adds to the context and will certainly give you the foundation for the activities and hopefully provide for some good discussion that we'll be able to have um, in class. So, the goal of PT education is to develop you as professionals. And in terms of being a professional, there's certainly a lot of academic and didactic knowledge that you will need to understand and work through and be able to apply in lots of different settings. But also, part of being a professional is developing those professional skills to allow you successful interactions with patients and peers and colleagues, in order to be your best self to provide the best care. So, you know, part of being a professional and being a successful professional is understanding yourself first. So some of the objectives of this chapter that set the foundation for this book and this course are to understand the concept of self, to understand the importance of self-knowledge in relation to the quality of life and the choices that you make, to understand the potential barriers to self-awareness, and also to provide some resources to help with self-awareness. And then we'll talk about facilitating self-awareness. And there's a lot of reflection that we're going to do going forward in the next several weeks. So certainly as a foundation to understanding self is, how do you know yourself? What does that mean? The nature of self and really can be described, I should say, and depicted by the various layers of a person and the various layers and aspects of your personality. So Carl Jung described or provided this depiction of the self. It's on page 3 of your text. Many of you have probably seen this in your past psychology courses, but it's good for just a quick review, because when we talk about the self, there are certainly various layers, with that outer layer, that that persona being the kind of the mask that you put on for others. It's that outermost persona, the public face that you all put on, that you want because you want the world and those around you to see you as being in control, as being intelligent, as being sensitive, as being perfect. So that's that outward public face mask that we put on. But understanding that underneath that mask there's an entirely, another aspect that is usually filled with a lot of doubts and insecurities. So they talk about that second layer of your personality or persona being made up of the ego and the shadow. Those are both parts of that second layer. So the ego, which can be described as the center of consciousness of mind, is the aspect of your personality that kind of gets the job done. It helps you make choices. It helps you problem solve. It helps you, or gives you kind of the courage to act, the patience to wait. The ego tends to be very protective. It tends to help you move towards safety and towards the status quo. But often it's filled with sometimes erroneous ideas, because it wants to keep you safe. So that ego is underneath. It's usually moves you towards safety. It has some omnipotence, but the position and views of your ego may change or fluctuate based on what you're hearing from other people, because you want to be safe, you want to be successful. So your ego may change your reaction to certain activities kind of based on what's going on around you. Underneath the ego, that bottom layer of the ego, is the shadow. And the shadow is the unconscious natural side of the personality. it's the unconscious part of that second layer, the part that tells us what we want to do, um, even though the ego says that you can't. It's that time when you do something, your ego is telling you, do the safe thing, do the safe thing, do the safe thing. Sometimes it's do the right thing, and something else happens, and your response is, I don't know what made me do that. What encouraged me to do that? That tends to be coming from, according to this psychological theory that comes from the shadow. And then deep within your personality, underneath those two outer layers, is the center of the person that is considered the essential self. So this is that authentic um, part of yourself, the essence of the person that incorporates unconscious and conscious layers. You can have your persona, you have your ego, and then you have your essential self that makes you unique. This is you at your core. And it affects, it really answers the question, who am I really? And begs the question, do you show everybody your real essential self? It's usually something we strive for, but there often are reasons that you can't live or demonstrate your true essential self. But recognizing that there are layers to everybody's personality, and what they show may be different than what they actually feel. So, how do we discover our true self? Certainly, it requires lots of self-awareness. Self-awareness is a hard thing. Sometimes we don't always want to look past the persona to discover true self. It requires a lot of self-reflection, and you need to put that into context. So, like, where do your beliefs and values come from? Do you question your beliefs? Do you question your values? Can you think of a value or belief that you've held for a long time and that may have changed now that you are developing and developing and helping you discover, certainly as you mature, your true self and your essential self. But it's when we don't participate in self-reflection, right, that patients or clients can suffer from insensitivity. If we don't recognize the ramifications of our decisions and actions, then other people can suffer. So hopefully that this text and this course are going to help you examine a lot of your beliefs and your values, where they come from, and what their implication is within your activities as an individual, but also as a professional. So, there are some, through, again, as we go through the course, and you hopefully will be doing some self-reflection, usually you will realize that there are some masks that you are using that aren't working for you really well, and will often make you not be successful when working with patients. So some signs and growth of self-awareness would, and again, these are according to some of the researchers in our text. So some signs of growth and self-awareness would be to drop being defensive, especially when you are challenged. To be more open to learning and to new experiences. To accept responsibility, especially in areas where maybe you're not real comfortable accepting that responsibility. To develop a sense of living as a participant in a fluid, ongoing process. To discover new things about yourself and others. Accepting and respecting differences, because you're going to meet and work with lots of folks who have lots of different opinions and values and beliefs that you do, and so being able to accept and respect those differences. And part of all of this growth in self-awareness is being comfortable in some of the gray, mucky areas that aren't totally black and white and really easy to work in. That being comfortable in the gray is a hard thing to do. Being comfortable with the, oh, it depends on the patient, or it may work here but not here, and not having that direct cut and dry answer is also a sign of growth and self-awareness. But that helps you to become capable of that unconditional positive regard for all humans, because we're talking about being the best professional, being the best version of yourself when you serve your patients and your clients. So kind of at the foundation, it's finding balance as a health professional. So we want you to be able to self-reflect where you are, to help improve self-esteem, to understand the backgrounds of others, to understand the influences of your culture, to break any codependence, to help understand where you are, so that we can help be more professional, work more successfully with patients, and that will help you with to help you relate to patients and clients, so that you will be sensitive, compassion, free from prejudice and negativity, and again, be the best version of yourself to be the best professional for your patients. So chapter 2 of the Davis book talks about families and the family's role and your family history and its role in developing yourself and your personalities and your values. So I want you just to think about, as we're going through this and as you're reading through the chapter and we do some of the activities, think about the role that families play in identity and self-esteem, specifically how your family helped shape your personality and self-esteem. I want you to examine the development of mature personality as described by Erikson. And we'll go over this. This is something you've had, I'm sure, in your psych classes, but it still holds true for discussion regarding personality development and some of the stages that we all have to work through as we mature. I'm going to talk about some of the concepts of open, healthy, and or troubled families. The concepts of generations in relation to families and work. You're going to be working with lots of different generations of folks when you're out in healthcare, and the importance of self-awareness, authenticity, and effective, mature helping, and certainly how your family impacts all of those concepts. So as you're reading through the text, I want you to look at page 15 on table 2.1. Skim through each column, and there are columns that talk about different characteristics of families. And I want you to think about, this is an activity that you can do, and I would like you to do before class, the characteristics of open, healthy families, the characteristics of troubled families, so the characteristics of closed, unhealthy families, and how your own family and your own experience may fall into some of these categories. I think it's important, that perceptions vary. Each family is complex and unique, and every family encounters challenges, and there's certainly no perfect family, and there's no best experiences. Every family has issues and troubles and challenges, and everybody is shaped very differently by that. So look through here and kind of see where you feel, or your perception of where you fall into, and the differences between what is described here as an open, healthy family, a troubled characteristics, or closed and unhealthy characteristics. So within that, as you just described, or you kind of looked through and described your perceptions of your family, or your characteristics of your family, kind of think about then kind of take a step back into Erikson's psychosocial theory of development. So these are stages of development that everybody goes through as they mature. And these are all listed in Chapter 2, pages 16 and 17. So read through these if you don't remember them, although, again, I'm sure you had them all in psych, one of your psych classes. But definitely very specific stages that everybody goes through that helps develop and layer that personality. And families impact each layer of these stages, and they help a person to usually successfully navigate the stage and build onto the rest of the stages as you go through. So, really starting at that trust versus mistrust, so that, when you were a baby, under a year, and you cried and need something, was that attended to? Did you know that you would be cared for? Did you develop that basic trust, and social interaction to provide all of your care? And then as got older, the autonomy versus shame and doubt. Then 4 to 5, you have the initiative versus guilt. So when you were 4 to 5, were you challenged to be initiative, to take initiative, to try new things, to try new things without fear of failure? So all that is important when were your activities as a child perceived as being stimulating, or were you stimulated and encouraged, or were your activities perceived as being a nuisance, and were you in the way with your curiosity? That affects how you pass through that initiative versus guilt stage. When you're in your between 6 and 11, the child moves into more seriously that world of competition, and that separation of work and play. So you think about industry and being industrious versus inferiority and not being successful. And you start to think about social worth and the background of your parents. And at this point, you start thinking about things like clothes labels and identity, and all of your perception of yourself starts to become defined a whole lot here. Were you rewarded for your industry and self-worth or not? 12 to 18, that identity versus identity diffusion, where you're starting to become your own person. Were you able to successfully separate from your parents, establish new bonds with others, your friends, peers? You're kind of, at this point, still uncertain to meet the demands of adulthood, but you're starting to develop those activities and characteristics to be successful in adulthood. You're starting to develop that strong sense of identity, hopefully that will carry you beyond the teenage years. When you get into intimacy versus isolation, it's that first phase of adulthood, that you're working out your sense of identity. You're now dealing with those sexual and psychological intimacies that occur between two people at that age. Achievement is characterized by the ability and the willingness to share with another mutual trust. Right? Are you able to share and truly trust with somebody in a more intimate way, or do you tend to be more isolated? As you get older or beyond that, personality is shaped by generativity versus stagnation. So these are kind of considered the basic agenda of middle age. Guiding, this is the area where you're guiding the next generation. You're parenting, you're employed, and you're looking back on what's happening, and hopefully you're deciding that you're working for the good. If you look back and don't feel that way, you may start to turn inward and become very self-absorbed, and stagnation can occur. And then the final stage is integrity versus despair. So those are the later years when you're accepting yourself and your life as you've lived it. You're looking back and not having any regrets. You're thinking hopefully good things, and that you have integrity. You feel good about your activities and your life, and there's no despair. Hopefully, there's not any despair, because at this point you're starting to think about death. That can often be hard for those in later years. So, again, look back through those stages of development, read through them. The examples of the book are much better than mine. I think it's unrealistic to believe that each stage is totally successfully completed, but think about, as you go through them, how family and others help you and mold you to um, to to go into the next stage. And it's how we respond to others and situations that's greatly influenced by our sense of selves, the adequacy in our self-esteem that is founded by successfully moving through some of these stages and some of these characteristics. So another thing to consider when we're talking about families, but also talking about workforces, is all of the different generations that you might have to work with and work for. The next couple of slides are tables that we put together here for this course on page, let me find it, 22 in your book. There's another table regarding the differences in generations. So kind of look through and pay attention. In today's workforce, this is one of the first times in history that we often have 4 or more separate generations working together. So not only will you be working with patients that come from a variety of generations, but you'll also be working with colleagues who are from a variety of generations. And everybody is formed and founded differently based on what went on and going on in lives as in the times that they grew up. So really kind of think about these generational differences, and how they might affect how you work and who you work with. So again, some of the years are a little different if you look through the book table as this table. So they talk about, people being born before 1900 as being the lost generation, 1901 to 1924 as being the GI generation. And here is more where the people that you'll probably be seeing are those born between 1925 and 1945 as the silent generation, the traditionalists. In your book, they call them the builders. This was the first time that elderhood had the elder generation lived with affluence in compared to their families. They worked very, very hard. They were often very risk averse because of their parents who had to scrimp and save and be very, very cautious. Then you have the baby boomers between 1946 and 1964, where they were, as a youth, they were often indulged. There was some community spirit. They're optimistic. This was the kind of that father knows best family order, but also goes into the Vietnam protests and Woodstock, things like that. So think about as how that generation was raised. They were more relaxed. They were the first that were getting into mass and traditional media. They were very brand loyal. They were loyal to authorities. They were often commanding, and they were thinkers. When you get into past the baby boomers, Generation Xers, that tended to have more hurried childhood. These were often the latchkey kids, because at this point both parents worked and needed to work. So there was, during that stage, an increase in youth crime, a fall in test scores because there was less family and home involvement, especially for those latchkey kids. These, people as adults preferred free agency over loyalty. They were not as loyal to companies and corporations as they used to. This was grunge, hip-hop, politically pragmatic, non-affiliated. They would rather volunteer than vote. tend to be more practical, spontaneous. They were not loyal to brands. They would switch all over, and they would they were more credit savvy, and they were doers. Then you have the millennials, and this chart calls that age group millennials. Your book then separates out this age group into kind of the Gen Ys and the Gen Zs, if you will. So born after 1980 or after 1982, those millennials, right, where they tend to be more emotional, participative, no brand loyalty at all. Definitely a lot of you have a lot of influence by friends. At this point, I would this is kind of that everybody gets a trophy generation. There's a lot of child protection laws which were appropriate, but also we thought everybody needed to be successful. And there are other definitely negatives that can be considered with millennials. There are definitely characteristics that are considered negative. I don't think, those are all real accurate, but can I just kind of pay attention to the differences, the way you were raised versus your grandparents versus your parents, and how your different beliefs are founded, and how that can cause for kind of conflict in working situations, and how you have to communicate and be accepting and be open to all of the different perspectives that are going to be going on. But think about that, because you can think about cultures in relation to, you can discuss people in relation to cultures and generations, but know yourself first, because that's the key of being able to relate to others without being judgmental, and without being without being stereotyping, right? Don't judge yourself or others, because no family is perfect. And then healthcare, kind of finally, if you will, healthcare self-esteem. So again, this is all about finding balance of as a healthcare provider. This is understanding yourself, where you come from, and how you developed in terms of finding balance. So your self-esteem, understanding the backgrounds of generations, needing to know yourself first in order to be successful for yourself and for your patients. So read through that chapter. There are a lot of terms that I probably did not explain really well, but I want you to kind of just understand where you're coming from and set the stage and foundation for the rest of the chapters and